talk about the muscles of the abdomen. This is on 110 of your lab manual. And let's go ahead and get started with our first muscle. Well, this diagram actually shows all of them. So there are 4 separate muscles that are muscles of the abdomen. If you can conjure the image of a skeleton, our skeleton, you might realize that the abdomen, right, we have our vertebral column that goes down the back, but we have our ribs that protect our heart and our lungs, but we have nothing, there's no bone that's going to protect our internal organs like our stomach or our liver, our intestines. And so really what we have in this front region is just abdominal muscles. And they're going to support and they're going to hold our organs in. So let's look at the 4. We're starting off here. I'm actually going to start off with the deepest one first, which is transversus abdominis. So let's just take a look at that. So here's transversus abdominis. Please remember the US on the end of this name. Students like to say transverse abdominis, which is not correct, right? It's transversus. And if you look at the fibers, they run transversely. So they're going to wrap around your abdomen. And if you think about, so we can also see that the muscle disappears in the front, right? So the muscle is going to, if you were to put your hands around your waist, that's basically where transversus abdominis is. It's going to have fibers that approach the front, but not all the way. It'll wrap around the sides, and it'll have fibers in the back, but not go all the way to our vertebral column. So when you compress these muscles, you are literally squeezing your abdominals, so sort of compressing your abdomen. So if you've heard of people saying, like, squeeze your abs, so pull your belly button in towards the back, toward your spinal cord or vertebral column, that's the kind of action that transversus is going to create. It's going to create a compression or a squeezing inside the abdomen. So it's not going to rotate your body, it's not going to flex your body, it's just going to compress because the fibers are these transverse fibers. So if you look at the action, it compresses the abdomen to increase IAP, which is intra-abdominal pressure. So in straining or creating this intra-abdominal pressure, this is kind of like bearing down, having a baby, creating, if you are picking up something heavy, you tend to use this muscle and create a lot of intra-abdominal pressure. All right, so let's go to the next one. So the next one that is, one superficial to transversus abdominis is going to be our internal oblique, and then let's talk about the other one too, the external oblique. So these 2 oblique muscles are going to run at angles, oblique angles, and they're going to be opposite. So if you remember our intercostals, right, it's the same orientation as our intercostals. So if you look at the fibers of external oblique, it's that same direction. If I'm going to put my hands now maybe into my pockets of my jeans, it's going to run in the same direction as my internal obliques and my external obliques and external intercostals run that same direction where you're putting your hands in your pocket. Internal obliques and internal intercostals will run in a perpendicular direction. So they are going to, when you contract these muscles, they actually contract and rotate your torso in opposite directions. All right, so if you look at your obliques, our external oblique and internal oblique, you only need to know the origin for external, our lower 8 ribs, inserting onto our iliac crest and linea alba. So let's find the iliac crest right here. This is our iliac crest. And our linea alba. So notice that this external oblique also the internal oblique, right? The muscle actually doesn't go all the way to the front. It stops short, and there's a big sheet of connective tissue that sort of continues to the very front midline of our body. So our external oblique here stops. Then there's this nice big connective tissue sheet, and that has a name, actually. It's called the rectus sheath that I'll talk about in just a second. And it's going to continue in and connect this midline down the body. This midline is called that linea alba. So I will mention this again when we talk about the rectus abdominis. If you look at the actions of our obliques, so both of these guys are going to help us flex laterally and rotate, right? So if you do a sit-up, if you're asked to do a sit-up and twist at the top of the sit-up, this is the muscles you're working there. That twisting action, the rotating action is the job of your obliques. Now let's look at the rectus abdominis. So the rectus abdominis is one of the most recognizable muscles because it gives you the six-pack. And the reason is because it is intersected by pieces of connective tissue. And those pieces of connective tissue are called tendinous intersections. So you do need to know this and identify this on the exam. And then the midline running down your rectus abdominis is called the linea alba, which is another structure that you need to identify on your exam. So because of these connective tissue intersections, right, we have a piece of muscle, it disappears, a piece of muscle, it disappears, so it gives us that sort of six-pack appearance. Now, the origin is going to be the pubis and the pubic symphysis, which is down here. And then it's going to come straight up our body and go all the way up and insert onto our xiphoid process of our sternum. And it also laterally inserts onto our ribs, the cartilage of our ribs, right, 5 through 7. This is the muscle that's going to truly flex our trunk. So when you do a sit-up, right, this is the muscle you're using. And it also can depress the ribs. So when you exhale forcefully, right, if you push the air out, you're using your abdominals to do that, and you're actually using this rectus abdominis because it has that insertion on the ribs. So you can push your ribs down, forcing the exhale, and also increasing intra-abdominal pressure. Okay, so those are the 4 abdominals. So let's take a look at these abdominals in a slightly different way before the model in here. So here is your abdominal cavity, right? So let's take a look at the 3 muscles. We have our first deepest one, the transversus abdominis. We have our second deepest, the internal oblique. And we have finally our superficial one, the external oblique. So notice that these 3 muscles are pretty lateral, right? They don't go all the way back because this is going to be where we're going to have our rectus spinae group. And then in the front, they stop short. So that all of these muscles will sort of create the same tendon here, this flat sheet-like tendon, which is going to be called the rectus sheath. So you want to know this. The rectus sheath will wrap the anterior and posterior side of our rectus abdominis. So our rectus abdominis muscle is kind of like inside a sleeping bag of our rectus sheath. So the reason why we have this rectus sheath is because we only have this one muscle in the anterior portion of our abdominals, right? So this is, if you don't have really strong muscles, then you don't have a lot of support to hold your organs in. So this rectus abdominis muscle is being supported and reinforced by this very tough rectus sheath. And notice that the linea alba, right, so down the center of our rectus abdominis, we have this connective tissue midline, the linea alba. So there's no muscle here, right? It's just the linea alba. All right, so this is another way of looking at it. So now let's take a look at our models. So if we want to look at our deepest one, you actually have to flip this chest plate of our models around, and we can see these transverse fibers of transversus abdominis. Right, now notice the transverse fibers disappear, and then we have our rectus sheath, the posterior side of our rectus sheath, right? And in this model, it's been cut away. So the rectus sheath has been cut and cut so that we can see the rectus abdominis, right, through there. So the posterior side of our rectus abdominis is being shown in this view. If we go to the outside, right, we have our model here. So here's our rectus sheath. This is our superficial side, right? So on the superficial side, we have our external oblique only. On the deeper side, we remove the rectus sheath. And be very careful because we have the internal oblique here. So if you look carefully at the fibers, the external oblique, the fibers are running down like you're putting your hands in your pocket. These are not running that same direction. So be very careful. The superficial side shows the external oblique. The deeper side shows the internal oblique. And then we have our, of course, our rectus abdominis. All of this is rectus abdominis. And we have our tendinous intersections running across, and our linea alba coming down the midline. All right. So there's another structure that I want you guys to know about, and that is going to be our inguinal ligament. So here is our superficial, or sorry, yeah, our surface anatomy of the abdomen. So we can clearly see like the linea alba, the tendinous intersections of our rectus abdominis. We can see how the oblique stops, right? So we have our muscle belly here, but then it disappears because the rest of the way around, right, it's going to be the rectus sheath, so it just becomes an aponeurosis, that sheet-like tendon. So external oblique on it both sides. This point here would be the xiphoid process, right? So this is where the rectus abdominis inserts to. The rectus abdominis laterally, if you go out laterally, then it's going to insert onto the costal cartilages of our ribs. Okay, so let's take our attention down here to the inguinal ligament. And I want to go back to this very first image that I was showing you. So we're going to talk about this inguinal ligament. So let's look over here. This is a ligament that will come up again a few times during the semester. It is formed by the free inferior border of the external oblique aponeurosis, right? So our external oblique muscle becomes this really nice big flat sheet and then rolls in on itself to create a tunnel. And this tunnel is called the inguinal canal sometimes, but we call it the inguinal ligament, and structures will run through this. So in males, there are structures called the seminal. Well, we have structures that go to the testes, so the blood vessels, the nerves, the vas deferens or ductus deferens will have to travel through this inguinal canal to reach the testicle and then bring, for example, the sperm up into the pelvic region, right? And in the females, there's a ligament that runs through that helps to stabilize the uterus. So there are some anatomical terms I want you guys to know. So this, let's start off by saying we're going to talk about something called an inguinal hernia. This part of your body is vulnerable to a lot of intra-abdominal pressure. So let's say you're lifting something really heavy and you're creating a lot of intra-abdominal pressure. What could possibly happen is that pressure builds up so much so that your intestines can actually come through that inguinal canal. So I'm going to say here that you need to know the opening here is called the external or superficial inguinal ring. So you need to know that. And then not shown, if you follow this through, right, there's another opening that faces your pelvic organs, and that would be the deep ring. So you would have a deep ring inside, and you'd have a superficial ring. And with enough pressure, the intestines, your small intestines, can actually get forced through the deep ring and sort of pop out that superficial ring. So that's called a inguinal hernia, basically a herniated intestine. Here's another image of what could happen. So in males, right, in males, because that inguinal canal connects blood vessels and structures to the testicle, in severe cases, the small intestine can actually drop into the testicle. So that is quite severe. This is what an inguinal hernia would look like on the outside, right? It would be an abnormal bump. And depending on how severe this is, it can be sort of a mild treatment, maybe manual manipulation of sort of helping the intestines go back into their normal position, or in severe cases, surgery might be required to fix the problem. Here is, so anyway, so you want to know the inguinal canal, you want to know the superficial ring, deep ring, you want to know what circumstances can bring about an inguinal hernia and how to describe what an inguinal hernia is. All right, so this is just a nice cadaver shot of our abdominals, transversus abdominis, right? We have our internal oblique here, our external oblique is way up here. It's been cut away so that you can see other deeper muscles. You can see the nice, very tough connective tissue that creates the rectus sheath, and beneath that you would have the rectus abdominis, very long muscle here. All right, I'm going to stop there.